So now we have a technology, and I'm putting up another slide right here. Now we have a technology that allows us to see the embryos pretty much in real time, all the time. And it's also evolving now to the point where we can do automated computer tracking of the embryos. And the computer can look at the embryo development, and you're seeing, for those of you in the room, you're seeing this on the screen right now. The computer can see when the embryos divide, the timing of when they divided, did they divide at an appropriate time or not, and did they divide from 1 to 3 cells, or did they divide from 1 to 2 as they're supposed to. And the computer can actually help the embryologist decide which embryos should be selected for transfer based on cell division parameters that predict this embryo has a high likelihood of succeeding or this embryo has a low likelihood of succeeding. And this technology is used in conjunction with what the embryologists normally do. So we still look at them, you still have a real person who's looking at them, but we're now using this technology where we can basically see the entire history of the embryo every 5 minutes over a period of several days, and we can make much more objective selections of embryos for transfer. And this is a very exciting technology for us as embryologists because it's a non-invasive technology. We're just watching the embryos. We're not actually going in and doing a biopsy or taking anything away from the embryo. It's very non-invasive. The light levels that these cameras use are extremely low, and we're able to see every mistake that an embryo makes now, so we can make much better decisions on which embryos to transfer. And this technology is really helping us to transfer a single embryo more of the time now, because we can be much more confident about the embryos that we're selecting.
And that's a trend that I think we've seen all day, is
Right.
more and more information about the embryos. And the more information, I mean, right now, even with all this technology, we probably still only have the tip of the iceberg. But the more information we have about these embryos, the better we can figure out is this a baby or not?
Mm-hmm. And we don't have to transfer 2 or 3 or 4 embryos anymore.
Yeah, when you're more sure.
It's not necessary.
Yeah.
And will some of these time-lapse images help with like genetic screening? Like, will they like move forward with that, like with the time-lapse?
So the next sort of era in time-lapse screening, I think, is identifying now not only which embryos are developing normally, but perhaps which embryos are genetically normal as well. And screening embryos genetically for chromosome content is also a technology that's being widely used right now, and it's growing very rapidly. Because again, if we have that embryo that we're going to transfer and we know that it's chromosomally normal, again, that reduces our need to put back 2, 3, 4 embryos at one time. If we can put back a single normal embryo at embryo transfer time, there's no need to put back
the same pregnancy rate as we used to with 2 or 3 embryos.
Yeah. So the problem with genetic testing is that it's an invasive test. You have to go in and take away some cells from the embryo to actually find out if it's genetically normal or not. And maybe time-lapse and genetic testing will marry up in the near future, and a lot of the genetic abnormalities that are in embryos might be predictable based on cell division profiles of embryos.